Today, we will discuss arrhythmia, but really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Arrhythmia is a condition where the heart beats irregularly, either too fast, too slow, or in an uneven pattern. In simpler terms, it means your heart isn't beating in a normal rhythm. How to know if you have arrhythmia? 1. Palpitations. You might feel a fluttering or pounding in your chest. 2. Dizziness or lightheadedness. Feeling faint or dizzy can be a sign. 3. Shortness of breath. You may have trouble catching your breath, especially during physical activity. 4. Fatigue. Feeling unusually tired or weak, even without much exertion. 5. Chest pain. Discomfort or pain in the chest can also occur. If you experience any of these symptoms, especially if they are severe or persistent, it's important to see a healthcare provider for evaluation. They can perform tests to determine if you have an arrhythmia and what type it may be. If someone has arrhythmia, here are simplified steps to take. 1. Stay calm. Help them relax. Anxiety can make symptoms worse. 2. Sit or lie down. Encourage them to sit or lie down to avoid fainting. 3. Monitor symptoms. Check if they have chest pain, dizziness, or shortness of breath. 4. Call for help. If symptoms are severe or last a long time, call emergency services. 5. Avoid stimulants. Make sure they don't have caffeine or other stimulants. 6. Encourage medical attention. They should see a doctor for a proper diagnosis and treatment. Always prioritize getting professional medical help. In the hospital, here's what doctors may do to help someone with arrhythmia. 1. Monitoring. They will check the patient's heart rate and rhythm using machines. 2. Medications. They might give medicine to help control the heart rate or restore a normal rhythm. 3. Fluids. They may give fluids through an IV to keep the patient hydrated. 4. Electrocardiogram. They will perform an ECG to see the heart's electrical activity. 5. Cardioversion. If needed, they may use a controlled electric shock to reset the heart's rhythm. 6. Further tests. They might run tests to find out what caused the arrhythmia. 7. Treatment plans. Based on the findings, they will create a plan for ongoing treatment, which could include lifestyle changes, more medications, or procedures. The goal is to stabilize the patient's heart and prevent future issues. Here are some commonly used medications for treating arrhythmia. 1. Beta blockers, e.g. metoprolol, atenolol. These help slow down the heart rate and reduce blood pressure. 2. Calcium channel blockers, e.g. diltiazem, verapamil. These medications relax the heart and lower the heart rate. 3. Antiarrhythmic drugs, e.g. amiodarone, sotalol, flecainide. These help restore a normal heart rhythm and prevent further arrhythmias. 4. Anticoagulants, e.g. warfarin, apixaban. These are used to prevent blood clots, especially in people with atrial fibrillation. 5. Digoxin. This medication can help strengthen heart contractions and control the heart rate. Always consult a healthcare provider for the right medication and dosage, as they will consider individual health needs. People at an increased risk of developing arrhythmia include 1. Older adults. As people age, their heart's electrical system can change, increasing the risk. 2. Those with heart problems. People who have heart disease, previous heart attacks, or heart valve issues are more likely to have arrhythmias. 3. High blood pressure patients. High blood pressure can strain the heart and lead to irregular rhythms. 4. People with diabetes. Diabetes can damage blood vessels and nerves, affecting heart health. 5. Smokers. Smoking can harm the heart and blood vessels, raising the risk. 6. Heavy drinkers. Excessive alcohol can disrupt normal heart rhythms. 7. Those with sleep apnea. This condition can cause breathing problems during sleep, affecting heart function. 8. People under stress. High stress levels can impact heart health and increase the risk. 9. Athletes. In some cases, intense training can lead to arrhythmias, especially if not managed properly. Maintaining a healthy lifestyle can help reduce the risk for these individuals. Now you need to watch my video on bronchiolitis or have a look at metabolic acidosis.